Hello friends, myself Vijay Gupta, your educator for physiology, and today we'll be discussing about the basics of why do we need to learn physiology as a part of your academics, as a part of your upcoming examinations, or as a part of your studies. So what is physiology? As a very simple way, physiology is the study of the functioning of the various systems of the body at systemic level as well as at cellular level. Your body is made up of various systems, and every system has got its own functions which function under normal range. So physiology teaches us the normal range and the normal functioning of all the body systems. Say for example, the heart is a part of cardiovascular system, and as a part of clinical studies we take blood pressure or heart sounds as one of the parameter. So the blood pressure is 120 by 80 mm of Hg, which we consider as normal range. So that is the heart as an organ. It tries to maintain the pressure from 120 to 80 mm of Hg. So in this way every system has got its own way of functioning, and in physiology we try to understand those function of the system, because once you know how the normal things work, then only you will be able to differentiate how those things are not functioning normally or what is pathology. Then that's what disease has come into picture. So if something is not functioning normally, it becomes abnormal, and that's what the disease sets in. So before going to that part, let us just enumerate, let us just try to understand what are the systems we are going to study and how the physiology is divided subject wise in various systems and chapter wise. So physiology as a part is divided in three important categories. A basic physiology, which includes general physiology. General physiology introduces about the cells, homeostasis, how does the body's environment works, and there are various body fluid compartments and how do they are working with each other. So general physiology is all about the basics of physiology, a very important chapter because this forms the basics of all the further systems in the physiology. Next is nerve muscle physiology, which forms a very crucial role, or which plays a very crucial role when you study CNS or other body systems where a neuron and a muscle are required to function together. Then the third one is blood physiology or hematology. Study of blood always plays an important role in all your studies. Next, once you are done with basics physiology, then comes your systemic physiology. Now you are going to understand each system in detail. So there are 8 systems which we are going to discuss in detail. Number 1 is cardiovascular system, that is heart and blood vessels as one of the system of blood and its flow. The respiratory system, which helps us to understand the functioning of the lungs and exchange of gases and the transportation of gases. Gastrointestinal system, it helps us to understand about the digestion process of the food, absorption of the food, assimilation of the food, all those things. Renal system, or you can say excretory system, is a part of urinary system which helps us to understand how the formation of urine takes place. How does kidney play a very crucial role apart from urine formation in other body functioning. Say for example erythropoiesis, that is formation of RBC. One of the major contributor is erythropoietin, a hormone, and that hormone is majorly produced in kidneys. So a person with kidney disease might also suffer from anemia. So these are some of the things which you are supposed to integrate. Of course, that's a third part of physiology. And then we are going to study the endocrine system, the hormones. How do the hormones are being synthesized, how they are released, what are the functions of those hormones, and if there is something disorganized secretion of the hormones, that is either they are secreted in more quantity or they are secreted in lesser quantity, they cause certain conditions, and we are going to study those conditions also. Next, we have a central nervous system, CNS, the brain, spinal cord, PNS, that is peripheral nervous system, and how do they work all together. Of course, CNS is divided in various subtopics or subsystems like spatial senses, where we study about vision, hearing, taste, smell as one of the systems separate, but as of now I will just include it in the CNS part. Then we have reproductive system, where how the male gametes, female gametes are formed, how does the fertilization occurs, and what are the various stages of the gametogenesis, and which are the hormones which play a very crucial role in gametogenesis and other things, puberty and all those things. Apart from this, when you are done with basic physiology, when you are done with systemic physiology, then we move on to the applied physiology. Then we use our knowledge to understand how these various systems they work together to maintain the homeostasis of the body, and they are categorized as acid base regulation. One of the very important topic is acid base regulation. So you can see the acid base regulation involves the functioning of ECF, extracellular fluid. It involves the functioning of lungs, respiratory system, and also kidney play a role in acid base regulation. So here three organs are working together to maintain the environment of the body. Shock and syncope very closely related with the heart and blood vessels, but yes, it involves various systems and how do the systems they fail and how do they work together when the person is given a shock and a syncope. Temperature regulation itself is one of the very important topic. And yes, after temperature regulation, we have the applications of physiology. How do you apply this knowledge? This knowledge is applied in various subjects like medicine. Once you know the normal functioning, after that you can understand what are the diseases and how does these diseases can be treated, becomes a part of medicine. So medicine is one of the very important, you can say, applied part of the physiology. Then pharmacology, how do the drug interact? So once a knowledge of physiology is good, you can always design, or you can always have a very proper, you can say, implementation of the pharmacological part. Drugs, how do they change, how do they alter the functioning of the systems, how can you use a drug in a particular way so that it can bring it back to normal. Pathology, of course, as I discussed, if you know the physiology, then you can understand the pathology, what is normal, and if that is not normal, how it become abnormal. So that's how you can compare in this pathology. The application of physiology also involves in ENT, ear, nose and throat, called as otorhinolaryngology. Then OBGY, which involves gametogenesis, female reproductive system. Radiology, once you know the organs and their functioning, and if there is any you can say any sort of disease which involves that organ itself, its functioning is getting altered, then how it can be visualized in radiograph. Of course, radiology also involves a very good knowledge of anatomy, which is not part of the first year subjects. So radiology is of good physiology also understanding gives a better approach towards radiology. Then of course ophthalmology is again a part of special senses in physiology, which this basic knowledge you can apply to the subject of ophthalmology. So overall these all systems which you study, CNS, CVS, RS, then kidney and GIT, it gives you a very holistic approach to understand physiology and apply this knowledge in the various other subjects. And yes, that becomes a very good approach towards your studies or for your examinations or for your academics. So let us start our journey to physiology with our first chapter, that is general physiology. So in the next video we'll be discussing about general physiology and the topics we are going to study in general physiology. Thank you.